Hey, pollen is in the rise. You go outside, your child has breathing issues. It might set off an asthma attack, allergies, and all kinds of things. And I'm going to talk to you today about the 6 stages of breathing issues, starting from a little baby all the way up into adolescents and teens. And you might find you or your kid in one of these stages from the very beginning, in the middle, at the very end. So let's chat, shall we? You're going to be surprised by the first one, because the first one has nothing to do with the lungs or breathing at all. It has to do actually about how your child was born. So you see that C-section babies, well, actually they can't compress the lungs, so they can't take their first gasp of air and breathe and clear the lungs. Also, they're often picked up using their head to pick up the baby, which can cause neurological compromise. So why am I talking about the issues with birth? Because the nerves can be affected, and if the nerves are not communicating with the lungs correctly, well, it sets your child up for one, breathing issues or immune system issues that show up in the lungs. So what we start to see is maybe reoccurring ear infections that happen. It could be at the age of 6 months and go on for a couple years. Often the medical solution for this is ear tubes. Well, it helps drain the ears, but that drainage goes down into the lungs. So you start to see a history of respiratory issues, RSVP, bronchitis flare-ups all the time. And that can develop into allergy sensitivities like tree pollen, or every little trigger will send the body and the lungs into a breathing fit where they're gasping for breath. That can later, in the 5th stage, develop into asthma or chronic inflammation, where the child needs a puffer or inhaler all the time, or hey, any little trigger that the flu will cause a definite breathing issue, and the child's gasping for breath. And definitely this can lead to like autoimmune problems or even fatigue later on, with big mood swings, brain fog that overwhelms the body. So those stages are very significant, and they go in those stages. But what I find is, like, when we correct that nervous system, the child is able to overcome those by themselves without the use of drugs or surgery. So, hey, you might be stuck in one of these stages, your child might be stuck in one of these stages, and you start to say, hey, that sounds all too familiar. We need to stop this. And we want some options, not just medications or ear tube surgery, but how do we stop this from progressing even further or even getting worse, and then correcting as well. I'd love to be the answer for you. Hey, I am Dr. Randy Wirtz in Thrive Chiropractic. Take care. God bless. Hope to chat from you soon. Bye-bye.